was bound opening because already the land has been surveyed.
In fact, let me write to her. Then please draft me a letter to the Minister of Lands, and we have it go tomorrow morning. Asking for feedback, asking for the report. When was this survey done?
It's about 2 months
back.
Yes, asking for the survey report for when they opened the boundaries, mapping the land for the regional referral Masaka.
In fact, that land is intended to.
It's intended for the regional blood bank. Already the blood bank has promised us that if we get the land, we are assured of the land and the regional blood bank.
That is very important.
And that will ease us because blood is one of the problems we suffer from, and it's blood products throughout the region. So we usually have to go to Nakasero. We keep on the little amount of blood here, and the processing is done in Nakasero. But if we get that land, we will be able to have the blood bank here, and the processing will be done from here.
He has also planned a project of national regional incinerator, which will be managing medical waste in the greater Masaka area. Regional incinerator. It is also planned for Ministry of Health, where regional referrals have land, it is stationed there.
Come again?
Regional incineration of medical waste plant. So we hope if that land is properly secured, all those projects will come on ground. Another challenge, I don't know whether she talked about it, is about the age of this hospital. Our hospital started in 1927 as a dispensary. Later it
So this thing is like how you can do garbage.
Yes, safe medical waste disposal. Because most of the medicine, the waste.
Do they call it refining? They call it
incineration.
Incineration.
Yeah.
It's just making it disappear.
Disappear without contaminating
the environment.
Oh, nice. Not making it reusable.
No.
Okay.
And if it is regional, it can even cover all health centers and hospitals in the region.
Is this what they also want to put on the same land?
Yes.
And these facilities already, it's also ready for us. It's also just
it is mapped.
The land is the hindrance.
For us.
So with the land we shall get these two things.
Yeah. Yes.
Don't excite me, I go and fight for the land. Then it comes, then you say her.
The regional blood bank is an assured. Yes.
The age of the hospital.
Age, E-D-E-G,
Old.
Yes, okay.
Yeah.
It is an old hospital. Most of the structures need a lot of
dilapidated.
maintenance and repair, and probably some put out of use, and
get better structures that can
Have you
help
made
us
that
with a
report
better
to
flow.
the ministry?
yes, I think there is even a strategic plan for this hospital. It has been made, especially in terms of infrastructure development. And that is what we had actually started upon with the little whatever money we're getting from the government on capital development. So we had started on working on that, and one of them was actually the MCH, that maternal newborn complex. We need a lab complex.
We don't have a lab complex.
We
here.
have it is small currently where the lab is housed is small. It is supposed to have its own department and complex.
But again, if the existing
Yeah.
wards are properly renovated, widened, improved, they can serve. At least some of the mothers have entered and children in the complex. So these ones, for them to give quality services, really need to be refurbished.
Why do we have the worst bathrooms?
They are all very old.
They are
Well,
old.
But really, doctor,
let's
those
go-
ones you don't have anything, director, that you can spare. At least to just renovate the bathrooms.
One of the things that we are telling you, the infrastructure we have and the volume of patients and the attendants,
Even the budget.
yeah, and the
I'm
budget
like
we
the
have.
budget controller. We have been getting 4 billion for a year, which has cleaning,
That's
has
also money.
security, has renovation, has utilities, water and electricity, among so many other maintenance and repair costs. So there is little you can do. When you look at even our walkways, are
You're still
also
getting
bad.
4 billion. We said we've been getting. You're still getting. The
Now
same
they
thing.
have improved it to 6,
This is
Yeah.
an improvement.
which we also appreciate. So this financial year we anticipate to get that. But there are things which were compromised
Should
because
go
of
to
the
about
little.
10 a year.
So those were
So
the
do we
issues.
really need those things? Because we try as much as we can, but then the patients we get are overwhelming. There are many patients, and they are actually patients we are supposed to work on, because even the health center force cannot manage them, so they end up. And even here, the patients we receive not only in the greater Masaka, but also part from Barara. Part of Mobende people come here. Part of northern TZ.
But
also
now the
come
problem
here.
with these budgets is sometimes somebody says this money is not enough. Then you ask for the accountability, and it is also a struggle to account. I'm serious. You go to a place, someone is crying, they give us very little money. You say, okay, first give me the accountability for that little money.
Hours we have.
And then someone will start speaking in tongues.
In fact, we have even accumulated domestic areas because at times we end up requesting for the service for the good of the
I could
country.
access it maybe for 1 or 2 years myself, so that as I go to push for this at the front line, that is cabinet or parliament, I am also committed to what I'm defending. Otherwise, if I'm defending blindly, I might be challenged that, but exactly what is not enough, and I don't know. Yes, of course, I may not know some of the medical terms, but basically I could get the basic picture of why the money is not enough and why it has to be increased. Yes, so may I have maybe for last year and the other year?
Yeah, we can have it through our analysis.
Or if it's ready, I can even go with it. If it's not, you can always give it to me, or you can always come back to pick it. Now, the patients are complaining in my emails, in my messages, phone calls, that the medical workers, yes, I know sometimes they get overwhelmed, even as we get overwhelmed. I know sometimes they get overwhelmed, but people claim that they are extremely rude. And are the dental services free? Before I forget, we had a lot of complaints. We even had one who had a receipt for that day. Are the dental services free here?
The
We had
dental
a receipt of
services,
60,000.
we have the basic dental services. Those ones are free. Again, like
What is free? What is basic
like
dental service?
the tooth extraction
Yeah,
and
they
so
extracted
on.
a tooth and they
And
made him pay 60,000. It's literally what we pay in private.
It must have been a more complex procedure, because currently we are in partnership with the Equator University. Equator University set up a very advanced dental unit.
I was there when they were launching it on the world oral day.
Yeah.
I was there. I was still a senior presidential
So,
advisor. I was the guest of honor.
Again,
at
the
that function.
dental services are a bit complex, just like orthopedics. They are one of those where the utilities you have to buy outside the NMS miss budget and they are
No,
quite
people have to know.
expensive.
People have to know because we
They
are tired
quite
of
expensive.
our people convincing us that people pay money.
Yeah.
And the president doesn't want to hear it. The president says a lot of money is being picked. He's approving budgets and budgets every day for people to get free health services. So we need to understand where is the lacuna. The RCC should know that when somebody says, I have paid 60,000, he should be having an idea. Oh, he probably paid for this. I should know. We
Yes.
all should know transparently.
Yeah.
Not just
I think
presumptions and
the
assumptions that they could have paid
we
for
have
this or
been
that.
getting is we have not been having, I must admit, we have not been having a close interaction with the people, the political people, the people who are supposed to govern the people. So we have not had that interaction. People usually do not come here on fact-finding missions. People come, they visit the ward, they interact with the patients, they interact with the doctors and find out what the actual situation is. That would help to explain to the people what the basics are and what the whatever. What if it needs to be paid for, should be paid for. And then we work out a way of paying out for whatever. For those who really cannot afford, but they really need these services. You can find somebody has a broken leg and needs a hip replacement. And these are usually poor people, old people. Where are they going to get the money? Definitely they are not going. But if we made those arrangements, people came to do what? To know that it would help us. So that interaction between us and the leaders is very important.
Yes, we need to know if dental services are free, if eye care services are free, we should know why is this person paying 100,000. It is something that I have to know so that even when I'm told, I am able to link it to something. But if you say they are completely free, then people are running to us, whistleblowing with receipts.
They couldn't, and that's why they are given receipts. I think when a cost is receipted, then that is a genuine cost. And somebody should be
but doctor, what we need to know is what are they paying for? Because even you yourself, you have said the services are free.
I've told you the basic services. But if somebody, for example, had a broken jaw, we get accidents. Somebody has a complicated whatever, tooth extraction, which needs a refill, for example. Somebody has been having severe pain, root canal. Somebody needs a crown. All these are expensive materials which are not usually on our whatever drugs and sundry orders. And we have the people who have assisted us have to recover the costs. So those are some of the challenges.
The doctor is saying they have not. The doctor is saying they never interact. Politicians never come to them here in Masaka for interaction. Maybe because we have been having opposition politicians. I don't know. Maybe they don't care, or maybe they look at it as NRM government business.
To us, but for us,
kindly organize where periodically, every month, I must come to this hospital. Bena, in my calendar, schedule it every month. However, doctor, I want to promise you that sometimes I will do impromptu visits, surprise visits, spot checks. Those ones you won't stop me.
And when you
those are welcome to us, like I told you.
However, we shall have a scheduled visit.
I myself took an initiative, contacted you before you are even appointed minister.
Before you even became an MP.
And I told you we need that closer engagement. Actually, when you are still the president's whatever advisor, presidential advisor, because it's that one, that engagement which we actually need. It is advocacy for us, because if we don't share with you, there may be some more misconceptions which people in the community may think are actually criminal or they are transgressions. Yet if we interacted much more closer with their people, they would know what it is. But not only that, but also to increase our budget, to find a way how a specialized hospital works. Because most of the services we are going to give are specialized services. And therefore we would need a budget to get this equipment, to get these utilities for our patients. Because much as they are specialized services, the truth is that the people who are suffering from these illnesses cannot pay for them. You don't expect somebody who brushes every day, who has Colgate or Sensodyne and gets a dental checkup to get those complications. So it's usually the people who cannot afford the routine dental hygiene who are going to get those complications. And if they can't afford the routine, then the complicated cases, they are the ones who are likely to suffer.
Okay. Yeah. So RCC kindly organize. Ben, kindly get in touch with the RCC. Let us have a monthly interaction, a monthly physical visit to this particular, out to our regional referral, because it is our biggest hospital. It's the biggest hospital in our region. It's the referral. Anyway, so it's the biggest. Yeah, it could be a referral, but not the biggest. But even in the essence of hospitals, it's the biggest.
At one time,
we don't have
it
any
was
private hospital that
it
is
was
bigger
the
than
biggest, and actually, if you look at our outputs and the amount of the patients who come here, we have the highest whatever, and for us we are just like the patient load and the mothers who deliver here, apart from Mbale.
Do we still have mothers sleeping down, or we solved that?
We solved that.
Because we used to have people in a big tent, RCC.
The majority of people
the tent and the grass, people who used to sleep down, the ones that the president quarreled, the president was very annoyed with it when he came for his rally. His advance team had told him that people told them their mothers who sleep down.
Those are
so attendants. Are we done with that now?
Yes, the patients no longer sleep down.
But
again, yes,
now.
we still.
You remember he even asked about the complex. I don't remember who answered the question.
Currently don't sleep down. Our ward was that small ward you visited that night, and you can see the situation in which it was, the dilapidation. But we moved to the new complex. We have our mothers housed in beds, they all have beds, but we still have a problem of attendance. And you know how maternal and child health should be. You're not looking after one patient. The presence of an attendant for a mother is very important.
Of course.
Very, very important. And that is an issue we have not solved. Although we have solved for the mother, we have managed to solve for the newborn care, whatever, but we have not solved for the attendant. And the presence of an attendant for each and every mother is important. Yeah, so those are the
the attendants still sleep by the bedside.
Yes, they still sleep by the bedside. At times they have to sleep
as long
down
as the
in
mother,
the cold.
As long as the mother is on a bed.
But usually they judge you by the quality, because the attendants reflect the quality of care you give. And that's why even the rudeness comes in. So all the time you're chasing out patients, go out, you're chasing attendants, they would like to be with their mothers, you're chasing them out, what? It's not really a very good environment for
I'm
the
told
mothers.
that the medics, the nurses especially, are extremely rude. That has to stop. If someone is a bit overwhelmed, they can change shift.
Yeah, we are working on that again.
And I used to bring my baby here for immunization just to observe. I could afford the private immunization, but sometimes I would just come to, even before I became an MP and minister, I would come with my baby. And I would stay the whole day even after immunization. They would take her home and I stay just to observe. So
that is a national issue which we are working on as a ministry.
Counsel people, don't get tired of counseling them. RCC, while you're on the radios, weekly on the government show, remind medics to tone down the attitudes. Because I don't want to come and get a medic caught in the act, shouting at patients and being so rude. It's abuse of office. It's abuse of their position. And it's even professionally wrong and morally wrong. Someone is a new mother, you're shouting at them. Some of them have high blood pressures. The pressures are not yet down. The medic is rude, all over the place. So it's something we need to work on. Now I want to know if the surgery people have told you about my woman.
Yes, I've contacted them. I've contacted Dr. Sally in particular.
The other old lady whose people didn't have money for the scan, what have you done for her?
The scan, the old lady, the mother had cancer. That one I think went away. Yeah, she had advanced cancer. She was actually supposed to be taken over by the palliative care team. Yeah, so she was taken over by the palliative care team, and they are still treating her at home.
It was incurable.
Incurable, yeah, that's what palliative care means. Yeah.
Oh my goodness.
Yes, I wanted to go back to the equipment in the new complex. As we say,
have the surgery people gotten in touch with my woman?
They haven't yet. I've asked them to call me back.
Please get feedback from them, doctor. I'm very worried about
But
that
if
woman.
you trust me, I'll follow up.
I trusted you that day. Only for
Yes,
you to
but
give me
your assistants
shocking
didn't.
news
Your
that
assistants.
my poor woman was sent out because she didn't have money for niche.
Your assistants.
You should have lent me. You should have bought it for her, then I come back and pay for it. Yes.
By the way, we do a lot of that. Honorable, we do a lot of that. It's just because we don't speak, but we do a lot of
Please
that. Where we can
you will
assist,
live longer.
we do many of us and the colleagues do a lot.
Yes, more equipment in the complex?
Yes, he was talking major on maternity, but we have pediatric as well, which I think it's about 50% of the bed and mattress coverage.